My sister and I were babies when my dad first came to work at AHS. He's always been there for us as a loving father and a partner and political ally to my mother. Just as significantly, he's always served as a community doctor who for the last 30 years has tirelessly advocated for social justice.
There's something happening here.
My time at AHS was a wonderful, wonderful experience. The entirety of the experience gave me a real grounding. Working with patients every day, you can't help but understand and begin to see clearly, what they're facing. Every time you go into the exam room and you listen to a patient's story, you end up developing a deeper sense of what's going on and some of the inequities in our society, and then also a deeper commitment, therefore, to try and change things.
And I just admire the fact that all that he does, he still practices medicine. He still has that touch. So as far as I'm concerned, he is an administrator and a physician. And he has that balance and that understanding. I think doing both of those gives him the type of balance to be the type of person. So when he advocates for something, he knows what he's talking about.
So I carried away from AHS a deep sense of community. It gave me the ability to see how grassroots efforts can be combined with advocacy efforts and to have a broader impact that goes beyond the local community, but then goes at a state level as well as a federal level, that we can actually get something done if we put our minds to it. And AHS was the experience for me that showed that that could happen, that it was true.
Rooted in advocating for the health needs of the Asian American community, Dad went on to work in the Alameda County Public Health Department. Today, he continues to fight for the health needs of all underserved communities at the Alameda Alliance for Health and as chair of the board for the California Endowment.
Art can be very easygoing, it can also be very tough. If he wants something to happen, he's dogged on it. He makes sure that it happens. He made a significant contribution in calling for the first state of emergency for HIV/AIDS in the African American community in the nation, with a lot of opposition from the powers that be.
In the Alliance where I currently work, we are at the front end of a transition of discovering how well managed care can deal with a low-income population. And we're experimenting on how well you can actually manage their care as opposed to managing profits, which is what most health plans are known for in the commercial world. If there's any lesson that we've learned in the last 30 plus years of building wonderful services for our community, is that it's not enough. We grew many of these services from community and student efforts and community organizations that had the creativity and were committed as problem solvers to addressing what were gaps in our policy and our government systems, so that the advocacy piece becomes a critical part about influencing decision makers and policy makers to see that there are problems, number one, and then to contribute to effective solutions. So our role now, as I see it, is to work with the younger generation and to share experiences and to more specifically share the concrete experiences that we've had at Asian Health Services to show where advocacy and service, when paired together as a dual goal, can achieve the policy breakthroughs as well as creating the models that are necessary for improving health of our community.
He's been a guy with this great vision, and we've always tried to chase after him.
Growing up, we always resented Art Chen's words of wisdom. But now that we're older, my sister Mia and I admire our dad's passion and commitment, and I hope more will join him in advocating for community health.